to the International GP Recruitment Programme, whatever stage you're at. I'm going to ask you in a second what stage you're at. But welcome also to being a GP in the NHS, and welcome for wanting to be part of the NHS, wanting to be a GP within our fantastic health service. So what we wanted to do before we start was ask you a question, if that's okay. We want to ask you a poll question. We want to ask you why you want to work in the NHS and why you want to be part of the International GP Recruitment Programme. So we're going to go to a quick poll, and we want you just to click on whichever one applies to you. So just click on whichever reason applies to you. Are you looking for a new challenge? Do you want better opportunities for your family? Do you want to work in the NHS to develop your career? Financial reasons, money is important to all of us. Are you passionate about the NHS? Unfortunately, you've only got one vote per person.
So pick what's most important to you.
That's right. And you can see those results coming up. So that's quite nice for us to. It gives us a real, feeling, because I know that, Maureen, you've interviewed quite a lot of doctors for the.
So I've been interviewing doctors and speak to a lot of doctors who are interested in applying for the programme, and I've always taken aback by all the different reasons and all the different things that people already know about the NHS or want to find out about. So we're really pleased to have you join our GP team, and it's great to find out about all these variety of reasons, and that you feel as passionate about the NHS as I do.
Yeah, a few people do.
Yeah.
So thank you very much.
Thank you.
Okay. So what we wanted to start by looking at what we covered in our last broadcast. So we talked about the International GP Programme, and if you want to find out the sort of nuances about the programme, then that will be a really good place to look at. As Maureen said, it is hosted, and the link is there on the 14 Fish website. We looked at the structure of the NHS and how you fit into that, and we discussed the really important things, how nice it is to be a GP in the NHS.
Yeah, absolutely. And then we met Mrs. Thomas as well. So Mrs. Thomas is a patient who's going to be registered at the surgery that I work at, and we're going to follow her journey. So we met her in the first broadcast, and we're going to take you with her for this broadcast. We also talked about how the GP practice receives payment for Mrs. Thomas's care, and that's really topical, Kim, because since our last broadcast, actually things have changed quite a lot. So there's a new GP contract, and the payment and funding streams we talked about are slightly different. So go away and have a look at the new GP contract. It's really interesting. If you listen to the first broadcast, it will help you understand what the GP contract consists of. So I would recommend listening to that broadcast and then go away and have a look at that new contract. And we sort of talked about what you could do before to get yourself prepared to come to the UK.
So we looked at we wanted you to have a look at the cancer waiting journeys, cancer waiting times, because Mrs. Thomas has got a suspected cancer. So we wanted you to look at that. And we wanted to look at the National Institute for Health and Care Excellence, which we call NICE. And we will be referring to NICE an awful lot during all the broadcasts. So that's quite useful. So let's look at what we're going to look at today in our broadcast. So we're going to look at access to a GP. We did show a video of Mrs. Thomas accessing a GP last time. We're going to look at that again. We're going to look at something called the Care Quality Commission. We're going to look at that. We'll look at chaperoning, a massive issue within GP practice. We're looking at referral waiting times in the NHS and the e-referral system. So quite a broad topic today, and I hope you're going to enjoy it anyway. So a few sort of logistical things about our broadcast. This broadcast will finish at 1 o'clock. It takes an hour. It will be recorded, and we will send you the recording to this presentation and also the presentation. Please do ask questions. There is a discussion board alongside our on the side of the screen. We've got a colleague, Nick, who will be looking and monitoring your discussion board, and Nick will give us some of the questions later. So if you've got a burning question or you want to email us at the end of the presentation, then we're very happy to do that. We did have a lot of doctors who emailed us after the last presentation. And thank you very much for sending us some of your contact details. It's been really helpful for us to get a feel for who's in the room today, but also if you are interested in the International GP Programme and you haven't already started that application journey, then NHS England will have your contact details and we'll be contacting you to have a chat about that. So that's really helpful. So if you haven't already and you are interested in the International GP recruitment journey, then let us know and we'll send you the link and we'll put you in contact with NHS England. So thank you for that.
So we'd love to hear about where you're from, and because you all come from all different places, and it's absolutely fascinating what you're going to be bringing to our NHS. So please do type in the discussion board where you're from, and we're also going to put up another poll. So we recognise that some of you are actually already living in England. You might not be working. You might be working but not as a doctor. You might be working as a doctor but not actually as a GP. or you might be in the EEA, outside the EEA, you might be from a recruitment agency or not a doctor and just curious, and you're more than welcome to. So please just type in, click the one that's most appropriate for you.
That's really useful, isn't it? Look, a lot of people within the EEA, I think that's the biggest sort of group. If you, in your discussion board, you could just write the country you come from, Spain. We had some doctors in Poland last time, Bulgaria. So that's just really nice for us to know where you actually come from. So thank you very much. Well, here we've got somebody from France, Spain.
Oh, hello, Lee.
So thank you very much for that. That's really,
Hi,
really
Jeffrey.
Nice. That's really, really nice. Okay, thank you ever so much for those polls. It just really helped to find out where you're coming from. So wanted to mention to you something we mentioned last time, which I'm going to reinforce again today, which is about the GMC app. So I obviously work for the General Medical Council, and we're going to talk throughout Mrs. Thomas's journey about our standards and guidance. So we will be talking about that. But before I do that, just a quick summary of our data protection regulations. Just remember that your name is there when we see you at the side of the screen. It will be recorded, this presentation, and it will remain on the websites for 6 months. So, you know, you just need to be careful with that, really. So just think about that. Thank you. So, yeah, GMC app, really helpful. And I know that you've got it, Maureen. So,
I do, and I find it really useful. So you might be sitting in a practice meeting, and actually one of your colleagues might have brought a case to discuss over coffee, and there's something quite a simple ethical issue. And actually, it's quite useful to have the app on your phone to be able to click and say, actually, the GMC guidance says this. It makes things much easier to deal with. So yeah, I'd recommend that you download it and just use it, because a lot of our principles in general practice are underpinned by the GMC Good Medical Practice.
And part of your international GP recruitment process will be doing simulated surgery, multiple choice, so that will be really, really helpful. Good. I would recommend you Good Medical Practice in Action, which is some really good ethical scenarios on the app, so you can do it. Yeah. So Mrs. Thomas, we met her last time. She's a 58-year-old lady who lives lives in a semi-detached house on the outskirts of town with her son. We saw last time that she found a breast lump and she wants to make an appointment to see her general practitioner, and we're going to look a lot more about that appointment. We did some filming for Mrs. Thomas at Lambton Road Practice, which is where Maureen works. So we're going to talk a little bit about that.
So I have registered our imaginary patient, Mrs. Thomas, at Lambton Road Medical Practice. So Lambton Road, this is a picture that I've taken whilst walking into work. It's based on the first floor there, so you can see the letters just in the sunshine saying Park Health, and that is where our GP practice is based. So we have consulting rooms, and we have specialist rooms for nurses. We have a big reception and waiting room, which you'll see. On the ground floor there, we've got a pharmacy actually, and you'll meet the pharmacist later on in Mrs. Thomas's journey. But quite interestingly, at the back of the ground floor, there's an area where there's lots of outpatient appointments taking place. So we have consultants that come in from some of the local hospitals, and then they run their clinics from there. We have an ultrasound service run from there, and it's just helpful for patients to be able to access that outside of the hospital. So they really like that. And then on the third floor at the top, we do have other organisations. We had a physiotherapist that was there for a while, a private hospital. So the patients really like being able to access their GP surgery with all the other services.
Almost like a one-stop shop, really.
And you will have heard of some of the more innovative GP surgeries, such as Bromley by Bow, where they actually have a social prescriber. So they might have social services or the tax man sitting in their surgery. So I have a feeling more of these health centres will become like that.
So we wanted to talk to you a little bit about the Care Quality Commission. The Care Quality Commission is a regulator of systems, in other words, a regulator of services. Like the General Medical Council, I remember last time, is a regulator of doctors. And we wanted to talk to you about the Care Quality Commission because it's very important to you as doctors. Now, Lambton Road is rated as good in the Care Quality Commission, and Maureen's going to talk about that in a second. But we wanted to get you thinking about Mrs. Thomas again. Does she know what the CQC Care Quality Commission ratings actually mean? So we'll have a look at the next slide because it actually gives you the ratings on the next slide for the Care Quality Commission.
So the Care Quality Commission, we're going to call them the CQC, and you'll hear a lot about them when you're in general practice. Like Kim said, they are an independent regulator, and there used to be 3 separate regulators for different parts of healthcare, such as mental health. But in 2009, we brought them all together and formed this one organisation. And what they do is they inspect care homes, dentists, care agencies that go into people's homes, mental health services, community services, and GP practices to look at these 5 sort of areas. So the questions that they focus on are they safe? Are they effective? Are they caring? Do they respond to people's needs? And are they well led? And then based on that, the practice will get a rating. So I'm really proud to say that Lambton Road has a good rating. And 2/3 of general practice has a good rating over England, so that's really good. And it's quite nice to actually go and look at the CQC reports for practices, because they're published, they're publicly available, and you learn about lots of different things that different practices are doing really well as things that they need improvement for, and what they do to try and improve them. So one of the practices, I'll tell you, Kim, one of the practices that I used to work at had a gardening club for their elderly, because they were based in a population where there were a lot of elderly and there was a lot of loneliness, and that was something that CQC really celebrated, responding to patients' needs. So go and read the CQC report for the practice that you might be going to, or any practice. Yeah.
I'm certainly really proud of my own practice, because I'm part of something called Neighbourhood Connections, which is a volunteer service. So we run surgery every Wednesday afternoon in our GP practice, meeting patients who the GP referred to us for loneliness and for accessing support, really. It's amazing things going on.
There are some amazing things that are going on, and we don't often hear about them. But for Mrs. Thomas, the CQC rating is actually really useful, because it allows patient choice. So it allows her to compare one practice or one service compared to the other. Patients will look at CQC reports. And actually, by law, you'll see on our next slide the little plaque that Mrs. Thomas will have seen in our waiting room. By law, organisations have to display their CQC rating in a place where they provide care, so that she'll see that we're providing good care, which will be reassuring for her.
Yeah. So we have got kind Nick, who's actually in our Manchester offices, who's going to see if anybody's got any questions to ask. But I can probably see the screen now, Nick, and I can't see any questions coming through at the moment. Is that right? Anything that you're seeing?
Yes. Yeah, nothing come through yet, but we do encourage you to send any questions through.
And please do ask questions. We like answering questions. We like talking about general practice and about the programme, so we're more than happy to. And I think we should just say hello then to everybody that's joined us. So thank you. We see some familiar names from people that joined us in our first broadcast. So really happy to see you again, Rob and Manuela, and welcome Danielle and Nazar. Thank you.
That's great. Thank you very much. Lovely. So what we're going to do now is actually see how Mrs. Thomas books an appointment with her GP. We saw her last time booking an appointment. We're going to recap that, really, because what we wanted to do was cover the patient journey right from the beginning. So she's found this breast lump. Does she think that her appointment is routine or urgent? So she's got to make that sort of decision. But we have information on the website, which we'll talk about in a minute, which helps her make that decision. We're going to show her in a minute telephoning the practice, but she can also visit the practice. She can look online on her telephone through an app called Patient Access, which we're going to look at in a minute. She can go to a GP hub, and I know that you've got GP hubs in your practice area.
Yeah, so where I work, we have two practices which are quite local to us, which run the GP hubs for all the local practices. So all the local practices, they come under CCG. So look at that King's Fund video from the first broadcast, which tells you what a CCG is. But so basically, if a patient calls up our practice, needs an appointment that day, we haven't got any appointments left, we can actually access those hub appointments. So we'll book them in, and they'll see a GP locally. We'll be able to do all the referrals and blood tests that or any investigation that they might have had from their own GP. And that seems to be a system that seems to be working in most places. But find out what the GP hub or extended hours system is available in your area.
And there's 111, isn't there? 111 out of hours service. There's an advisor that you can speak to on the telephone. It's very well publicised in the UK, so patients do tend to know about 111. And there's a new 111 service where you can actually, the 111 service will actually access patient appointments at your local GP as well.
So that's thank you to the new GP contract. So they'll be able to book appointments in directly into your clinics. And if you want to find out more about 111, like Kim said, there is a lot of information out there. But if you want us to talk about it in any further broadcast, please tell us, and we're more than happy to do that. So tell us what you need, and we can tailor our broadcasts accordingly.
What we wanted to do now was actually show you Mrs. Thomas accessing that GP appointment, so phoning in. This was filmed at Lambton Road Practice, wasn't it? So with one of the receptionists there. So we'll show you that video.
repeating.
Okay, well, just a quick sorry for that. I know there's technical issues slightly at the beginning of that video with it jumping slightly. You can imagine the technical issues with videos, so apologies for that. But let's talk about the practice website.
Yeah, so Mrs. Thomas there booked her appointment on the phone, and just to say that all these videos are going to be available after the broadcast, so we can send you links out so you can watch them again in your own time. But perhaps she was wanting to book an appointment after the practice had closed, or she prefer to not speak to somebody. She might have gone to the practice website, so in a search engine she might have typed in Lambton Road Medical Practice, and she would have arrived at this homepage. So I've just taken a picture of the homepage to show you what our homepage looks like at Lambton Road, but most GP practices actually have a very similar page, because things are advancing digitally, and we're encouraging patients to access appointments online and some more self-care and be directed to appropriate professionals. So she will see something like this when she goes to their homepage, and actually you can see here that there's 8 different rooms. So she might just need a prescription, or there might be a letter that she wants to drop in, so she might go to the administration office. But in this instance she would click on reception inquiries, and on doing that she'd arrive at this page. So I think this is a really useful page, because you can see how things are changing. So if she wanted a prescription or a referral, or just wanted a test result, then she might click on one of those appropriate boxes, and she wouldn't actually need to see a doctor. So that would get her what she wanted, save her time, save the doctor's time, and save a valuable appointment, and just be all, in the whole, so much more convenient.
Massively.
So actually look at your practice website, see what other services the patient can access, and it's really useful, because then you can build that into your consultation. So I actually use my consultations when someone comes in for a sick note who I've met before, and I'll say, do you know, actually you can do that online now, so you don't need to waste your time to come to see me. Actually you can just do that online. So Mrs. Thomas, she still wants to make an appointment, so she would click on make an appointment, and this would lead her to this page. So this is the online consulting room, and I think this page also shows how our GP team is so different to what it was, say, even 20 years ago. For example, in your practice, you might be working alongside a clinical pharmacist, alongside a physiotherapist, a nurse prescriber, a social prescriber. You might have paramedics or care navigators, and all of these people are actually now part of that GP team. And what they do is hugely valuable. It frees up so much more time for GPs to deal with more complex cases, which really need an expert opinion. And it's good for the patients. They get appointments quicker and can access what they need quickly from appropriate professionals.
You were telling me earlier that you work with a pharmacist who sounds an amazing lady.
She is. So I work with Anne. She's a clinical pharmacist at Lambton Road, and she's fantastic. So she's soon to become a prescriber, so she'll be even more helpful for us. But what she does at the moment is for example, any letters that might come in from the hospital saying, this patient needs to be started on this medication, she will look at that letter, maybe phone the patient, see if they've got any of that medication. She'll organise blood tests, any blood pressure checks, anything that needs doing. She does all of that, and she'll arrange follow-up. She'll call them in. She runs a clinic. She might see ladies who are on the pill, on contraception, who perhaps need their blood pressure checked. She's really good at signposting too. So actually things are changing. So actually that patient could easily have had their blood pressure in the self-help area outside, which you might have noticed in our waiting room. And actually just send Anne a message. So things are really changing, and it's a really exciting time for general practice. I mentioned the GP contract earlier. So all these professionals will be coming into your practices, because that is part of the new GP contract. So Mrs. Thomas, she still wants to see a doctor. So she would click on this button, and this would take her to this screen. So patient access is a new patient access app. And
I've got it on my telephone. So if I want to make an appointment with my GP, I just click onto my patient access.
That's really, it's so useful. So it is a new way of patients making appointments. So I've shown you the website here, and there's a web address there so that you can look it up in your own time. But if you were to use the app on your phone, you would see actually that you'd be able to book an appointment. You might be able to order some repeat prescriptions, and you could also view your medical record. So this is something that I thought was quite important to talk about, because you have to be mindful of what you're writing in the medical record now. So legally, we're encouraged to document as much as possible actually, and include relevant points of the consultation. So for example, when I see a young child who looks well, is jumping off the couch, I might write that in my notes.
Oh, well, if I read that as a mum, I'd be thinking, gosh, that doctor's making a judgment about my child being naughty, jumping off the jumping off the couch.
Absolutely, and the reason I wrote it in was to show that the patient was actually well. So just be careful how you word things and what what words you're writing down in your medical record, because patients, very, if not already, from your practice will be able to access those notes and see them.
Okay, so we thought we'd have a look at now the role of the receptionist, because you've seen the receptionist in action. You've seen how patients can avoid contact with the receptionist. They can do things online, but the role of the receptionist is so fundamental to your GP practice. In fact, I have to admit that my mum was a GP receptionist, an amazing job. So we thought we'd show you a couple of sort of minutes or a minute long video just explaining what the receptionist actually does. So here's Chessie. So there we are, what Chessie actually does, which is a fantastic job, and it's a beautiful reception area that you can see there. But it can vary between practices. Chessie was welcoming patients and visitors. She was signposting to appropriate healthcare professionals. She books in, she amends, she cancels patients' appointments. She also registers new patients, but you can actually do that on the Patient Access app, which is really good, and on your website. She schedules appointments, particularly things like if a patient really needs a double appointment or a longer appointment for any reason, then she'll help sort of get that sorted. She answers inquiries. I mean, receptionists, we stood in your practice and they never stop. They're actually constantly either on the phone or greeting patients. And she liaises with the GPs, the administration staff, and also the practice manager, who's the overall manager of the practice, and manages that. But I know that you talked about a really innovative receptionist that you'd heard of.
So just as I was saying that the roles in general practice are changing, I visited a practice where the receptionist role was really interesting. So they didn't call their receptionists, they call them front of house staff, and that was recognising that actually they deal with patients face to face, they're the first point of contact, and they have a really important role. But it also recognised that actually they will meet patients that will never meet anybody else in the practice. For example, a son might come in to pick his mum's medication up, but himself never really needed GP appointment or a blood test or a blood pressure check, anything. And so they trained up their front of house staff to give flu vaccines.
That's amazing.
And I think they had a bit of a healthy competition between their receptionists. And actually one receptionist was recorded to have given 900 opportunistic flu vaccines in a year, which I thought was amazing. And people traditionally thought nurses give flu vaccines, but that's not the case actually. With the right training, you can train up and involve all your practice staff.
It's an amazing new initiative, really. It's quite incredible. So we thought what we'd look at now was Mrs. Thomas. She's checked in with the receptionist. She's now sitting in the waiting room. I'm sure many of us have sat in waiting rooms, but actually sitting in a waiting room can be very anxiety provoking. So we thought we'd think and ask Mrs. Thomas what it was like to be just waiting there to see her GP, because I think when Mrs. Thomas comes to see you, this is how she's felt before she's come to see you.
And I think you can forget, sometimes you've got a really busy clinic, you might be running late, you might have had a sick patient and you're just trying to trundle through, get through your clinic. And sometimes you forget that actually on the other side, it might have taken quite a lot for somebody to come and see you. And actually that waiting time in the waiting room, what are they thinking about? And what agendas and feelings have they sort of cooked up while they've been sitting in the waiting room?
So let's have a look at Mrs. Thomas and what she's actually thinking. Okay, so we now know that she's pretty scared sat in her waiting room and she's really worried. And this is the start of her journey. We're going to look in a minute at her consultation journey and what actually happens to her in her journey. But before we start that, we'd like to do another poll, sorry. So we'd like to ask you where you are on your international GP recruitment journey. So we're going to go to a poll, where are you on your international GP recruitment? And we're going to ask you whether you are interested in applying, whether you're waiting for an interview, whether you've received an offer, fantastic, and you're beginning to placements and relocation. Some people might be from a recruitment agency, whether you're on the preparatory phase of the international GP recruitment process, or you're on the actual part of it, or that you are post international GP recruitment. So this is a bit more of a complex question, so I do apologise for it, but we'd really like to know where you are on your journey, and I know a few people are voting now, so that's fantastic. We are beginning to see more people apply, and we've got, I know in London you've placed quite a few people already started.
And it's quite nice when you do apply, you meet people who might be further on in the journey, or a different part of their journey, and actually we're all learning from each other. So it's a really useful thing to really network up and meet each other, which you have the opportunity to do on the programme. In London we have a Health Education England run afternoon that happens once a week, which I'm sure is similar across the regions, and that is a good networking event, good chance for you to build up your own GP social circle.
So it looks like we've got a variety of people here, which is fantastic.
It's really good to see.
Good range.
Yeah, and if you are interested in applying, still thinking about it, have any questions, then please contact us, and that applies to all of you. So wherever you are in your programme, in your journey, then please get in contact.
So we're going to look at the consultation now, aren't we, really? Because this is the nub of being a GP and being Mrs. Thomas. So we're going to introduce that consultation, and this is the first time that this GP, Dr. Kowalski, has met Mrs. Thomas. So we're going to show again a video of their first consultation. So hope you enjoy it.
So thank you for watching that video. Would you mind just writing in the discussion board if you've had any problems with the video or any audio, just to let us know. But like I said, the links will be available, which we'll send out after the broadcast for you to look at those videos again.
And if there are issues when the recording comes out, we'll make sure that the separate links are sent to the YouTube where you can actually watch the videos as well. So that's great. But it's also good to know if you haven't had any as well, if it's going okay. So thank you ever so much. So chaperoning, we mentioned that we would cover this a little bit during this broadcast. So you saw Dr. Kowalski, she offered and the most important thing is offered Mrs. Thomas a chaperone, and that was really important. And this applies whether you're the same gender as the patient or not, and it applies also, it doesn't just include examinations of the breast, genitalia or rectum, it can include other other investigations, other examinations as well. I think that's really important that you think about that. So the next slide lets us think about what you should consider before you do an intimate examination. You should explain why the examination is necessary, just as Dr. Kolowski did. You should give the patient an opportunity to ask questions, explain what the examination will involve, and get the patient's permission, because consent is really important. We will be looking at consent quite a lot later, actually, so that's quite important. Then you need to offer a patient a chaperone. That's the important thing. Give the patient time to undress whilst maintaining their dignity. So those are the really important things. So we'll go on a couple of slides now. So we'll go on to the next slide and the one after that. But chaperones, it's really important that chaperones are sensitive, that they think about the patient's privacy and dignity, and they're able to reassure the patient. They must be familiar with the procedure, and they must stay for the whole of the examination. That means that they must be inside the curtain with you and able to be with the patient, and be prepared to raise concerns if they're worried, really. And I know that a lot of GP practices use a variety of professionals. So they use nurses, other doctors, medical students, but also receptionists are. They've done some special training to be chaperones, haven't they? And you mentioned to me that your receptionist, not only when they're a chaperone, that you know who's available to be a chaperone, but also that they will have to document later.
Yeah, so we have a little laminated sheet by our computer, which you just can look up at, and it will tell you all the chaperones available on that day. And also the chaperones are trained, and they understand their role, and they know it's not going to take a long time out of their day, and so they're quite happy to drop what they're doing and come over to you when you need them. And also they are all trained to actually go away and actually document what they saw in the notes, and which I think is really good for medical legal purposes. And I think a lot of places do that. But, find out what the chaperoning arrangements are in your practice.
Yeah, because they're individual, aren't they, really? And there are chaperoning notices, as Dr. Kolowski said, in each practice. So I think it's just important to think about that a relative or a friend is not an impartial observer. So I know that we were talking earlier, Marie, weren't we, about you have patients come with their children, for example.
Yeah, and I've always, I used to wonder actually if the mum, I'd invite the mum or dad in behind the curtains so they can see what I'm doing. But sometimes you get a funny feeling yourself. And actually, sometimes I don't actually offer a chaperone, but say that I'm going to go and get a chaperone. Because as much as the chaperone is there to protect the patient, they're there to protect you too. And they're there to be a voice for you should any complaints or any misunderstandings arise at a later date.
And that's why it's important to document who your chaperone is. Your practice has your chaperone documents, but if you haven't, then do write down who the chaperone is. If a patient makes an allegation a couple of years later, there's no way that you're going to remember. So remember, you can ask the patient to pop outside and wait in the waiting room while you go and get a chaperone. And I have heard lots of patients, as Maureen said, lots of doctors who don't offer a chaperone but will automatically say, I'm just going to go and get a chaperone. I'm just going to go get another person to be with me when I do this examination. And that's okay as well. So that's really important that you notice that. But ultimately, the patient's clinical needs obviously must take precedence. So this next slide is about documentation. I see, just glancing on the discussion board, somebody's asking about medical records documentation. This will be a theme throughout lots of our broadcasts. We've already talked about making a note, and the other thing is if a patient doesn't want a chaperone, you should sort of write down that it's been declined as well. But we will be talking about medical records, about documentation. Yeah, it's really important, isn't it? Really fundamental. Okay, so Nick's better charged to look for questions than we are. So Nick, is there any questions that are coming up that you'd like us to answer?
So I think I can see a question from Nick.
Oh, there you go.
Hi, okay, I have a voice now. We have one question about the pharmacist work at the GP practice, and the question is: Does every GP practice have their own pharmacist working in the actual practice itself, or is every GP practice linked with a pharmacy that is in the neighbourhood?
So that's a really good question, Lee. Yes and yes. So most practices now will have some sort of links with their local pharmacy, and that might be just through conversations that are happening. Each CCG has a prescribing pharmacist, a prescribing lead, and they visit practices and try and help encourage these links. But with the new GP contract, more and more practices will have a pharmacist actually working at the GP practice. So the pharmacist that I was talking about, Anne, she actually works in our practice 5 days a week, runs clinics. She's there, you know, as much as any of the other GPs are there. So she is our dedicated practice pharmacist, but we do have links with pharmacies in the neighbourhood, and we're lucky to have one downstairs in our building. But we still send prescriptions over to pharmacies that are closer to some people's homes. So we have a couple that are in the local area. So most GP practices have a link with pharmacies in the neighbourhood. And actually now, yes, most GP practices do have a clinical pharmacist working there, or if not, in the next 5 years will do.
There you go. Okay, thanks, Nick. That's lovely. So let's see what happens. So what happens to Mrs. Thomas? They've done the examination, and let's see what happens and what the diagnosis, what the doctor's differential diagnosis is going to be. Thanks. Okay, fantastic. So you've seen what happened, really, what the referral is that Dr. Kowalski is going to make for Mrs. Thomas.
Yeah, so I think that's what we'll go on to speak about next is referrals. So the referral that Dr. Kowalski is going to be making for Mrs. Thomas is known as a 2-week wait referral. So all services commissioned by the NHS in England for suspected cancers have a maximum waiting time of 2 weeks.
Yeah.
So I think that's really special about the NHS. So if your doctor thinks that you've got cancer, then you will be seen by a specialist within 2 weeks. And we have some guidance for criteria for different types of cancer in different areas. But on the whole, it's things that it's all the clinical knowledge you already hold. So red flag signs for different types of cancers, such as PR bleeding, or for a bowel cancer, that's rectal bleeding for bowel cancer, or persistent dyspepsia for upper GI cancers. So the 2 weeks would start when the hospital or service receive your referral, or when the patient uses the e-referral system, which I'm going to talk about, to book their first appointment. The waiting time ends then when the clinician has either decided that actually there's no treatment available, or you decline treatment, or you've begun treatment or been referred to another service. And in this time, you might have had some investigations, you might have had some symptomatic therapy. And it's also really interesting that actually patients by law can choose where they want to go. And actually they can even choose which consultant's team.
Do you think patients know about that?
I don't think they do. And I don't think many GPs know about that. So I've had patients who've come in and requested a referral to a private hospital, to a consultant who also works in the NHS. And actually by law, you need to offer that. So that's something to think about, maybe something to talk to your supervisor about when you're in practice. And then for non-urgent referrals, the maximum waiting time is 18 weeks. So I mentioned the e-referral system, and I would encourage you to go and see this in action during your consultations, maybe in the preparatory or the INR phase. Sit in with somebody and see how the NHS e-referral service works. You will need to become very familiar with it because you will be booking patients' appointments in hospitals and services outside your practice. So what happens is they log into this into this website, and I've taken a snapshot of the page that they will see, and you will have given them a booking reference code or a passcode which they can use to log into the system to access waiting time for whatever service you referred them for across the area. So actually they can choose whether they want to travel a bit further and perhaps be seen next week, as opposed to wait for 2 or 3 weeks for appointment in their local hospital. So it allows some flexibility and allows patients to have a bit of choice and determine their care, which I think is really important. Equally, if you might be worried, because there are patients I have who I'm worried will not access the system or might not be able to use it. So I can do that too. So I can, during the appointment, rather than give them the password.
So you do it with them, sort of thing?
I do. So I'd sit there and say, oh, actually, Mrs. Thomas, we have an appointment with a breast surgeon. If this was a non-urgent thing, I'd say that we have an appointment with a breast surgeon who can see you next week. But actually, that's a bit further away, or do you want to wait for 4 weeks? And sometimes they say, actually, do you know what, I'll just wait for 4 weeks because I'm going to have a lot of trouble getting to that appointment. So you can do that for them, and it prints out the letter that they used to receive in the post, and you give it to them in their hand. And on there will be the password and the booking reference code, which they can use to change or cancel their appointment. So that's also really, really helpful for patients. So that's the e-referral system. So Mrs. Thomas, you would probably make that referral for her. It's a 2-week referral. As she said, she's not away. So you would probably go in and have a look and make sure that there is an appointment at a hospital she can get to within 2 weeks, and print out the appointment and give it to her.
Which saves an awful lot of time, an awful lot of energy, doesn't it really, if you can do it there and then for
Absolutely. And it gives you a bit of reassurance that you're going to see. And alongside the e-referral system, you have the option to write your referral letter. So that's something else that I would talk to your supervisor about, and no doubt you will have some teaching on this about what to include in referral letters and what they should look like. But you can attach that with your online e-referral system. There used to be a system where we used to fax cancer referrals, but actually with the new GP contract, fax machines have been phased out. Probably rightly so, because it's difficult, obviously, to have an email trail, and there were confidentiality issues where things were left in fax machines. So now the e-referral system will give you a confirmation that an appointment has been booked. And
it's much more joined up, isn't it, really, to be honest? And it's very reassuring for the patient to actually come in to see you with, like Mrs. Thomas was terribly scared, to come in to see you and to get that reassurance that you've done a great, had a real look at her, and that she's going to walk out that door with a referral to a specialist.
Absolutely. I think this is the way that the NHS and GP practices are changing, and I think you're all coming in at a really exciting time.
I'd agree with you. So we've got a lovely question mark up there to see whether Nick's got any other questions. I can see a couple of questions, one about referrals I think you might have to answer. So Nick.
Yeah, okay, we have a question from Rob asking further about this electronic referral and how it works in action. So how about complex referrals, and how are those handled? So say a patient who has a complex condition or histories.
So that's a really good question, Rob. So we, in our practice, we have a system where we have, it's called Kinesis, and actually even the e-referral system has an advice-only button. So you can contact a consultant. So say they did have a complex condition, and you wanted to have a discussion with the consultant about perhaps whether they need some further investigation before referral, or whether they need to go to another specialist, or there might be a specialist centre somewhere in central London or one of the big cities, and you can have that conversation with the consultant before making the referral. So you can do that on e-referrals. We use a system, like I said, called Kinesis, and usually they get back to us within a day. So it's like having a specialist advice at your fingertips. And remember, when you do the e-referral system, you write a referral letter, but there is also an option to tick other boxes to include their medication history, their problems. So you could put all their chronic or acute problems, and any important consultation. You can even include those in your referral. So actually, it saves a lot of time. But ultimately, the referral letter will highlight any complex conditions that you want the specialist to know about. And like I said, I think that conversation is really important.
Yeah.
Rob also follows up that question with how much are the electronic communications, texts and emails actually used in practice?
So we're using them quite a lot, Rob, which is really promising. So our practice will text our patients a day before to remind them of the appointment. But recently, so when I'm doing checking all the blood tests that have come in, before I might have seen, for example, a low vitamin D, which I would like the patient to take some over-the-counter vitamin D for that they can buy from a supermarket or pharmacy. Previously, I might have written a letter, or I might have actually used a telephone call appointment to call them and give them this information. But now I can actually text them.
That's amazing.
So from my computer, I will write a text message saying, "Oh, we tested your vitamin D. It was a little bit low. I recommend you go and buy this, this vitamin D from this place," and that's really useful because a patient gets their results, their information really quickly, and you've given them that message. Emails, we're coming round to that patient access app. A lot of GP practices have turned on the facility for GPs to leave you a message. So, for example, I might say to a patient, "Oh, let me know how you got on at physio for your back pain, and if it's not getting any better, then send me a message," and they can just log in their own time on the app. Say, Dr. Tar here. I've been to 6 sessions. I've been really good with the exercises. It's not getting any better, and now I'm off work. And that will prompt me to perhaps get in contact with another professional, perhaps try and organise an MRI if that's available in my local area, or refer them on. So we're using electronic communication much better. And I think, as you all join us, it's only going to get bigger and better. There's also video consulting, teleconsulting. There's all these things that are happening in primary care.
Exciting.
It is really exciting.
And we've got one other question from VRL. Can a patient ask for an even shorter time referral, such as 1 to 2 days?
So that would be if a patient wants to make I'm going to check with Maureen here, but if I wanted to see my specialist really, really quickly, I could choose to pay. In the UK, although we have the National Health Service, which we've talked a lot about how proud we are, you can choose to opt out of the National Health Service and choose to pay for a private consultation. A lot of people have health insurance through work, so they can make that decision. But sometimes you may not be able to get that appointment any quicker going privately than going through this 2-week rule, to be honest. A lot of people will try and weigh that up. A lot of people will decide that actually I'm not going to get it, I'm only going to get a couple of days quicker, that actually I'd be as well wait under the 2-week rule. Am I right in saying that, Maria?
Yeah, I think that's absolutely right. And the other thing to say is if your patient does want to go and see someone privately, so say they did want to see the breast surgeon privately, they still need to come to you.
Yes.
Because they still need a referral, and they still need you to refer them.
Yeah.
So there have been instances when people have come in and want to refer to a particular specialist, but I've thought actually maybe there's
another issue,
or there's further investigation that you need, or actually it's not appropriate. And GPs do refuse private referrals, so that's a really interesting question actually.
Yeah,
the small private world that we have in the UK.
Yeah, it's a complex one, really, isn't it? But I know it's different. And again, it's one of the differences between Europe, between all across the world, isn't it? These sort of nuances about private health service versus the NHS. But a lot of people are dipping and dipping out. You can go to see a private practitioner and then go back into the NHS.
Absolutely.
That's okay as well.
Absolutely.
There's a lot of, and you can. The nice thing about that is you can discuss that with your GP and have that honest and frank conversation about.
And your GP is not going to encourage you to go privately or stress that you need to use the NHS. It's very much an open conversation.
Yeah.
There are some more questions if we have time for those.
Yeah, we do. Yeah.
Okay, so we've got Jatin Shah is asking, are video teleconsultations covered by MDU, MDS?
So that is a really good question. I know the answer to that, and that is yes. but you still need to check with your indemnity provider. So indemnity is something else that we could spend a whole session talking about. But there are some main providers for GPs and other doctors in the NHS for indemnity cover. You do need to tell them that you're doing video and teleconsulting. And actually, when you do take out any sort of indemnity, especially with the changes in indemnity from the 1st of April, you need to tell them exactly what you're doing, and not take anything for granted. So in my practice, we sometimes do, for our patients, fill out private medical forms for, say, a taxi license or heavy goods vehicle driving or adoption. And in the previous indemnity, you wouldn't have declared that because that's just seen as part of your role in general practice. But that's non-NHS work. So you need to declare that to your indemnity. And it might affect your rate, it might not. In my case, it didn't, but sometimes it does.
Yeah. So when you start, I mean, like Maureen said, the international GP recruitment has its own indemnity insurance cover, and we could talk about, not it has its own cover, but we can contribute. So we can talk about that if you like, but actually there is some really good links that we can actually send you to which explain it. And like Maureen said, it's about talking to other GPs about the sort of cover that they have as well, and getting a feel for that.
And when you join, that is one of the big topics to sort of be covered by your supervisor and by your educational program as part of the IGPR program. So don't worry about that right now. We're all in the same boat, but it's not as complicated as it sounds.
But I would point out that good medical practice does say that you must have adequate indemnity and insurance, so it is really important. We thought we'd mention some other resources. Good medical practice we just briefly talked about, and I've already mentioned the intimate examination and chaperoning guidance that would be good to read. But those are some things we talked about in our previous sort of broadcast, didn't we, about things that you can actually have a look at and actually have a play with, because there's some online self-assessment tools and some learning materials, and Maureen's already mentioned the King's Fund video, which I really like as well, so I'd certainly have a read of that. That's really, really good. So our next slide is that if you wanted us to cover anything else on these broadcasts, and I know that I picked up one when I was reading earlier about medical records, for example, which we certainly will cover in the next broadcast, but if any ideas for anything in the future that you'd like us to cover, then we're very happy to adapt the broadcast and try and include things that you actually want to do. Before we move on, we'd like you to get you to just do another little poll, if you don't mind, before we finish. We've got a couple of minutes before we finish. We're going to ask you what you felt, how you felt today went, really. We're going to ask you to be honest. How would you rate this broadcast? Very good, good, neither good nor poor, poor or very poor. We are actually okay if you, whatever you say. So, we've got broad shoulders. And we want this to be useful for you. We don't want to do this if it's not useful for doctors from overseas. So we're trying to make it relevant for you and make it interesting. So it's nice to see a few of you put very good. I should mention the very poor was actually during the test beforehand. So we didn't wipe that from the test beforehand. We were having a bit of fun. So it honestly wasn't anybody on the call. But thank you very much. That's really, really useful. And there's one more poll. So my apologies for asking you to just do one more rating poll. But it's whether you think this broadcast will help you integrate into the NHS, yes or no. Because you're all on that journey. And it's important that, again, we feel that but this broadcast will really help you because we covered a lot about how the NHS works and how GP practice works. We haven't covered much clinical stuff, and we're aware of that because that's what you're going to cover, when you're out there, but also that's what you are already experts in. You're already expert clinicians. It's about these nuances about working in the NHS that we know that international GP recruits struggle with, isn't it, really?
And the information that I'm trying to certainly give you are things that I've learnt whilst being a GP, so just being in general practice, and that's sort of the beauty of the programme. So you have a preparatory phase, as we just discussed in the previous broadcast, at the beginning, which can be 3 to 6 months or longer if you needed, and in that time, that's an opportunity for you to really learn about general practice and the NHS, because you can't read or learn this from a textbook. This is from being on the shop floor. So that is what we're trying to give you through these broadcasts. So anything else that you've always wondered or want to know about, then please let us know, and we'll be happy to tailor the broadcast accordingly. And there were some of you that were interested in applying or still thinking about applying, and please go to the NHS England website. We've put the link there, but if you type in NHS England and IGPR into any search browser, it's usually the first link that comes up. There's lots of information there about the programme. Please look at our last broadcast. And also on that website there is an inquiry form, and that inquiry form goes to it goes to the NHS England International GP Recruitment Team, and they will be able to give you information about all the different regions and what's available to you, and talk through any questions that you have. So if you're still thinking about it, I suggest you submit an inquiry form so we can help you make the right decision for yourself.
And we'll also send you a little bit of a longer survey. It's actually only 4 questions, to see whether a little bit more information about how you felt today went. So please reply to that. We'd find it really useful. Our next broadcast is on the 1st of May between 12 and 1, and it's a lot more about the GP consultation, a lot more progressing Mrs. Thomas, looking at things like confidentiality, how we meet her son in the next broadcast, and we see what happens to her next, really. So we really hope that you'll join us for that, really. We wanted to thank you very much for coming today and for spending your time with us on the broadcast. I wanted to thank you from the General Medical Council, but I know Maureen wants to thank you from NHS England as well.
It's really great to see so many of you here and engaging with the broadcast. So thank you for being interested in the programme, interested in what we've got to talk about, and for being interested in general practice, because we would love to have you here joining our teams and working in the NHS, and we hope that we can help you develop and meet your motivations and aspirations as a GP, but as well as that benefit from all your skills and experiences.
So finally, that's our emails. If you want to speak to us, drop us an email. We've had lots and lots of, as I said, correspondence, and I always put, let me know how you get on. I love to hear about, how you're getting on in the UK once you get here as well. So thank you very much for your time, and cheerio.
Thank you.
Bye.
Bye-bye.
Bye.